In 2004, a study was published in The Lancet, one of the most well-respected journals that we have, that I think every single person on the planet should have read. It was called the Interheart Study. 52 countries, over 29,000 people, every major ethnic group and every region of the world. And what they set out to do was pretty simple. They wanted to know what actually causes heart attacks. Not theorize, not model it, but actually look at real people who had real heart attacks and work out what they had in common. And this video actually is pretty personal for me because my dad had a heart attack when he was pretty young. And so this is the stuff that I tell not just to my patients, but also to my family as well. Hello. If you're new to the channel, I'm Dr. Alex. I'm an emergency medicine doctor with nearly a decade working in busy NHS emergency departments across the country. And after years and years of treating preventable end-stage diseases like heart failure and heart attacks that we see literally every single day, I've made this big shift towards lifestyle medicine and longevity. And what they found in this particular study should have changed everything. They found 9 modifiable risk factors, 9 things that we can actually change. And these accounted for over 90% of the risk of a first heart attack globally across every population, men and women, every age group, the same 9 things, over 90% of risk explained by factors within our control. So why is cardiovascular disease still the #1 cause of death in the world every single year still? That's what I want to get into in this video. So let's go through the 9 factors first then, because this is where it gets really interesting. The single biggest risk factor, and it's not close, is abnormal lipids, specifically a high ratio of ApoB to ApoA1. Think of that as your bad cholesterol relative to your good cholesterol. This one factor alone accounted for nearly half of the attributable risk in the study, half. And the reason that matters is that most people have never had a lipid profile done. They've never had these checked with their doctor. They've never seen that number. They're walking around completely unaware. Now, the second one is smoking. So current smokers in this study had nearly 3 times the risk of a heart attack compared to non-smokers. 3 times the risk. And that is not a slow build. Smoking causes direct, immediate damage to the endothelium, which is the lining of your blood vessels. Every cigarette is an active insult to your cardiovascular system. The third one, no surprise, is hypertension, high blood pressure. And this is the one that concerns me the most because honestly, having worked in emergency medicine for, well, pretty much a decade, this is something that I see all the time, every single day. And the reason it's so concerning is that for most people, unless it's over, 200 where you get headaches and flashing lights and dizziness, most people feel absolutely nothing. It's silent, completely silent. And the whole time, your heart is working against a pressure load that it was never designed to sustain. Your arterial walls are stiffening. Your risk is accumulating all the time. In the UK alone, there are millions and millions of people with undiagnosed hypertension right now. Literally millions. And a blood pressure check takes 2 minutes. You can literally buy one of these machines on Amazon for 15-20 quid and check it yourself, but so many of us don't. The fourth one is diabetes, or more specifically, the cardiovascular consequences of chronic blood sugar dysregulation. Persistently elevated blood glucose damages the endothelium. It promotes inflammation and it accelerates atherosclerosis. The mechanism here is really well established. And again, type 2 diabetes in the early stages is largely silent. And most of this comes down to what we eat these days, these ultra-processed foods that are literally everywhere. My brother-in-law, who's 10 years older than me, has just been diagnosed with pre-diabetes. Now, he is a builder. He is active every single day from 7 a.m. till 700 p.m. And even he got pre-diabetes. It just shows how powerful these foods actually are. And he's not overweight. He doesn't have the most amazing diet, but he's not fat and he's strong. He's active all the time. It just shows us how much of a problem this is. Anyway, the fifth one, and this one's really important, is abdominal obesity. Not BMI, but your waist to hip ratio, because it's not overall weight that drives cardiovascular risk, it's your visceral fat. And this is the fat that sits around your organs. As I've said many times before in other videos that fat is metabolically active. It drives systemic inflammation. It disrupts your lipid metabolism. It promotes a prothrombotic state. It is not in a tissue. It doesn't just sit there doing nothing. It's actively causing your body some harm. The sixth one is really surprising to a lot of people when they hear this, and this is psychosocial factors. So stress and depression, loss of perceived control in, any part of your life, these were independently associated with increased heart attack risk. And that word independently meaning that when you control for every other factor, psychological stress still shows up as a significant cardiovascular risk factor. Now, the mechanism we don't completely fully understand yet, but we think it's about cortisol and your sympathetic nervous system activation, chronic low-grade inflammation, all of these things that crop up again and again. What we know is that your mental state is literally a cardiovascular variable. It's not wellness talk here. This is what the evidence shows. Now, the seventh one is low fruit and vegetable consumption. Pretty straightforward. Regular consumption was protective, and low consumption was associated with increased risk of a heart attack. That isn't complicated. It's not expensive. It's just consistently absent from a lot of people's diets, and a supplement will not replace that. The eighth one on the list is physical inactivity. So regular physical activity was independently protective across every single population in the study. And we're not talking about elite training. We're not talking about whether you can run a marathon or do a triathlon. We're talking about sort of regular, moderate, consistent movement throughout the day. And the dose of this physical activity doesn't need to be dramatic to have a meaningful effect on your risk. Just 10 minutes of walking after your 3 meals a day has a massive impact on your health. And if you want to learn more, then I did a video on this a couple of days ago. And number 9 is alcohol. So in the original InterArt data, moderate consumption of alcohol showed a very modest protective association, but we need to be really honest about how much the evidence here has moved since 2004. A large Lancet analysis in 2018 concluded that when you account for all of the health outcomes, including cancer, there is no truly safe level of alcohol consumption. The apparent cardiovascular benefit in these older studies is also complicated by a well-known confounding problem, which is that many non-drinkers in these datasets were former heavy drinkers or people who'd stopped due to illness, which makes abstainers look worse than they actually are, if that makes sense. The current picture is a lot more honest, and that is that alcohol is not a health intervention, and any apparent benefit at low doses is modest at best and contested at worst. Anyway, you're probably wondering why I even mentioned alcohol in the first place. Well, I'm including it because it was one of the 9 factors in the study, and I'd rather just give you the full picture than skip over something because it's complicated. My honest opinion is that alcohol is not good for you. No amount of alcohol is going to be protective in any way, but the occasional pint with your friends or the occasional pub trip or, the occasional, glass of wine at a wedding, these clearly aren't going to do you huge amounts of harm. And if anything, the social benefits of that are probably a good thing. So those are the 9 factors. Then every single one of them is modifiable. And together they explain over 90% of the risk of the thing that kills more people than anything else in the world. And here's the question that should be pretty uncomfortable. We've known this for 20 years. This data has been available and replicated and expanded upon, built into guidelines, and cardiovascular disease has not moved from the top of the global mortality charts. So what on earth is going wrong? Well, one of the things is that healthcare is generally structured around treatment, not prevention. And I say that as someone who has spent literally years working at the very sharp end of that system on the front line. Emergency medicine is extraordinary. We save lives in ways that would have seemed miraculous 50 years ago. We can literally have somebody through the doors of the A&E being resuscitated then into the cath lab within a few minutes, with a stent placed into their artery, moved all the way around to the heart, into the coronary artery, to literally save their life. But we are terrible at preventing that heart attack in the first place. That disease has been developing for years and years, if not decades. The prevention window is a massively long one. We have years to prevent this heart attack from even happening. The second point is that lifestyle change is structurally really difficult. The food environment pushes us towards processed calorie-dense foods. Most modern jobs are sedentary by design, and most of us spend the vast majority of the day sat down either at the breakfast table, on the sofa, in the car going to and back from work, or at work, sat down in front of the computer. Chronic stress as well is endemic. The architecture of contemporary life is misaligned with what the cardiovascular system actually needs. Basically, what I'm saying is that individual willpower exists inside this system that is not set up for prevention. And number 3 is that I think there's a genuine misunderstanding about cardiovascular disease. So many people tell me at work, it just runs in my family. There's nothing that I can do. My dad had a heart attack, and my granddad or my grandmother had a heart attack as well. And yes, genetics do matter. Obviously, I'm not dismissing that. But this inter-art study looked at populations with very different genetic backgrounds and found the same 9 factors explaining the same proportion of risk everywhere. Genetics influences your baseline. It shifts your starting position, but it doesn't determine the outcome. The important point is that these 9 modifiable factors operate on top of whatever genetic background you have. The most important point of this video is to know your numbers, know your lipids, have a blood test with your GP, know your blood pressure, know your glucose, your HbA1c, and preferably a fasting insulin if you can get that. But you've probably got to go privately for that one. If you don't know these numbers, then you are making decisions without information. Get them checked. It is basic, it's accessible in most healthcare systems, and it tells you where you actually stand. Just buy one of these from Amazon or wherever for 20 quid and use it. Check